Did you know that approximately 79 million Americans are currently infected with HPV, which is human papillomavirus, and almost all of them, they have no idea that they have the virus. Also, every single year, 14 million new cases are diagnosed in the United States alone. And for a significant portion of those people, the virus shows up as genital warts, which is a small, painless growth that can appear around the genitals or around the anus. So if you or your loved one has been diagnosed with a genital wart, I need you to know that you are not alone. There is a very clear path forward related to genital warts. Hi guys, I'm Dr. Peter Aziz, urogynecologist and pelvic surgeon. Today we're going to be talking about HPV genital warts, what they are, what actually happens with them, how do you get them, how do you get rid of them, how you stop them from coming back. So let's get right into it. So HPV is the most common sexually transmitted infection in the entire world. And there are also more than 200 strains of HPV, and they are not all the same. Some strains are considered to be low risk. These are the ones that can cause genital warts. However, the high risk types, these can cause cancer. Luckily, we're not going to be talking about this today. So how do genital warts form? HPV spreads through direct skin-to-skin contact during sexual activity. This includes vaginal, oral, or anal sex. Importantly, you do not need to have penetrative sex to get HPV. Even skin contact in the genital region can transmit the virus. So this is the hard part. Condoms can reduce the risk, but unfortunately does not eliminate it completely, because HPV can live on the skin that is not covered by a condom. Once the virus enters the body, it infects the outer skin cells. In most people, the immune system can clear it. However, in others, it causes the infected cells to grow in an abnormal way. And this is what you see as a wart. Genital warts can appear on the vulva, vagina, cervix, penis, scrotum, groin, or around the anus. They can be flat, they can be raised, they can be single, they can be clustered. Sometimes they grow to resemble a cauliflower. They are usually painless, but they can cause some itching, some burning, some discomfort, especially during intercourse. So now we gotta talk about an important question that I get a lot. Do HPV warts go away on their own? It's very tricky sometimes, but you cannot count on it. Studies show that about 30% of cases, genital warts do clear up on their own within a few months. It takes a while. The immune system fights off the virus and the warts resolve. However, in the majority of people, actually that does not happen. The wart persists, it grows larger, or it can actually spread. And even when they do go away on their own, the HPV virus can actually remain dormant in your system, meaning that it's just sleeping. The warts can return weeks, months, or even years later. So should you just wait it out? In my professional opinion, no. There are effective treatments available, and the sooner you address it, the better your outcomes are. Because again, untreated warts can grow, multiply, become a headache to treat. And they can be transmitted to partners during that entire time. So what does the treatment look like? Treatment varies significantly depending on the size, location, and the number of the warts. Also your overall health, whether you're pregnant or not. However, these are the available options. We're going to talk about them from least invasive to most invasive. So there are some topical prescription medications that they are applied directly to the skin. They require a prescription. Do not attempt to self-treat with over-the-counter products. Medication like Aldara or Imiquimod, this cream works by activating your immune system to fight the HPV virus. You apply 3 times a week at home, wash it off after a few hours. It can take up to 16 weeks, sometimes even more, to clear the warts. It's effective for many patients. However, it can cause some local skin reactions like redness, like irritation. Keep in mind, it is not safe during pregnancy. Another treatment option is Condylox, which is a self-applied topical solution. Also works, but it works by destroying the wart directly instead of activating your immune system. You apply twice a day, 3 days, then take 4 days off. You can repeat the cycle for up to 4 weeks. It works faster, it's effective, it's convenient. Same thing like Emiki mode should be avoided in pregnancy. There are some newer treatments like Verigen, which is a prescription ointment that is derived from green tree extract. It's applied 3 times daily for up to 16 weeks. Has good safety and tolerability, and it's FDA approved. It's not recommended in HIV positive patients or patients who have immune system problems. So let's say you don't want treatments, you want something quicker, or you fail medications. There are some in-office procedures done by your provider. They are usually safer, they're effective, especially for larger or more extensive warts. There is a solution called TCA. This is a solution that is applied directly to the wart by the physician. Works immediately. You can actually see the wart turn white as it's being applied. Requires weekly visit, but it's safe in pregnancy. Make it a first-line solution for pregnant women. There is also the option of cryotherapy that involves freezing. It uses liquid nitrogen and that's applied to the warts. So the cold destroys the wart tissue and it falls off over time. It typically requires multiple sessions, about 1 to 2 weeks apart. Same thing, well tolerated, and it's widely available. Another option is using electrocautery or electrosurgery. It uses like a little pen and it has electric current, and that used to burn and destroy the wart. Highly effective, often used for larger or clustered warts, done under local anesthetic in a clinic or operating room. Laser therapy also has some benefit in treating warts, like carbon dioxide laser. Can be used to vaporize the tissue with precision, particularly useful for extensive lesions, especially hard to reach areas like inside of the vagina or on the cervix and the anus, or when other treatments have failed. This is usually done under anesthesia. So for people who did not respond to any of those issues or they have very large warts, then we recommend surgical removal. Under local anesthesia or general anesthesia, these warts are physically cut away. This is the most definitive treatment and can remove all visible warts in a single session. So important note, these treatments, they eliminate the actual wart. However, they do not eliminate the HPV virus itself from your body. This is why recurrence is common. So why do warts keep coming back? Question that frustrates patients the most. And I understand why. You get treatment, the wart goes away, and then 3 months later, they come back. Why? What is going on? Because once HPV enters the body, it can remain dormant in the skin cells for a long time, sometimes permanently. Treatment removes the warts, but it does not eradicate the virus. When your immune system is weak, let's say illness, stress, other infections, poor sleep, the virus can reactivate and warts can reappear. So treatment is great. However, is there any way to prevent this from happening? Yes, there is something very important that you can do that can protect you from having this. Most important thing is HPV vaccine. It is one of the most effective tools that we have. It protects against the strains of HPV most responsible for genital warts and also strains that are most associated with cervical cancer. The vaccine is recommended for all children ages 11 to 12, typically before sexual activity begins. Any young adult up to the age of 26 who were not vaccinated earlier. Also, adults aged 27 to 45 may also have benefit, especially if they were not vaccinated before or if they were not exposed to HPV in the past. Keep in mind that the vaccine does not treat current HPV, it prevents new infections from occurring. So the earlier you get it, the better it gets. So, Doc, what about barriers and condoms? Consistent and correct condoms significantly reduces the risk, although it does not eliminate it. Because HPV, like we explained, it can infect skin in the genital area not covered by a condom. So even if you don't get it inside of the vagina or on the penis, you can still get it around the area, like on the scrotum, around the anus, on the vulva. Also, if you find this video helpful, like, share, subscribe. Release new videos every week on everything related to health. Thanks for watching. I'll see you in the next video. I'm Dr. Peter Aziz.